Hi, my name is Dr. Samintharaj Kumar and I'm going to talk to you about why we do sinus lifts, what are sinus lifts and when do we do this in dental implantology. When you have insufficient bone at the back part of the upper jaw, the posterior part, there is a need for us to increase the height of the bone levels at times. Now if we don't do this, part of the implant will stick into the sinus. Whilst a little amount is okay, by and large we would like all of that implant to be within bone. To do that, we have to increase the height of the posterior bone at the back of the upper jaw. This procedure is called a sinus lift. When you have a sinus on both sides of the jaw, the maxillary sinus basically occupies what is the floor of the sinus and the bone below it. That determines the amount of bone that we can place an implant in. And what we do as an implant surgeon is to raise the level of the sinus by doing a very gentle procedure, using an osteotomy and using a particular dental drill that allows us to move the membrane of the sinus upwards. As we do this, we usually replace that space with some bone. This bone can be particulate bone, also could be bone from you, and we can also mix that with a bit of blood as well. The blood products are typically platelet-rich fibrin that allows us to give very good consistent results with regards to raising the floor of the sinus. I can actually do this procedure with an implant. That is a procedure where a sinus lift is done and an implant goes in at the same time. This is single-stage surgery where you do not have to have the sinus lift done first, then followed by the implant on a secondary basis, which means 4 to 6 months later. By and large, most of the patients, if they have sufficient bone, they can have an implant and the sinus lift done at the same time.